Hi guys, my name is Sophia Thomas and I am the owner of LMSW Exam Secrets. And today I wanted to basically talk to you guys about what are key identifiers and the importance of learning what they are when you are going through the question. So let's dive right in, okay? What are key identifiers? Key identifiers are clues in the question or stem. I like to use question, or I really like to use the question stem, basically. Um, Learning what they are will help you with figuring out what the question is asking you to do. Because a lot of times we overlook certain things in the question stem. And it's important to know that you will need to pick out these key identifiers to help guide you with selecting the right answer. Okay. Why is this important? It is important because if you learn what the key identifiers are, you will have a better chance of picking them out for almost every question. So when you learn what they are, every time that you're going through the question, every time, I don't know how many times I have to stress it, every time that you're going through the question, you will learn to pick out these key identifiers if it's in the question, okay? And it will help you with selecting the answer choices. What is your role in the STEM? Are you a clinician, a colleague, a therapist, a supervisor, or intake worker, hospital social worker, family agency social worker? It is so important to know what role that you are playing because each role is different. Each social work role responsibilities are completely different. Some of them are the same, but overlap, but some of them are completely different. And so when you're in the question stem and you're saying that, okay, that you are a family agency worker, what do you do? If you are a hospital social worker, what do you do? So it's very important. It's very important to know the role that you are in when you are, what role you are in the question stem, okay? The work setting or work environment. Ask yourself, where am I in the question? Are you in private practice? Are you in a hospital? Are you in a community? Are you in a clinic, a school, or an agency? It is very important to know what work setting you are in. What phase of treatment is in the STEM? So the phase of treatment, the different phases of treatment, this basically goes along with the helping process. The initial phase of treatment, each question is different. Some of them will have in the initial phase of treatment, and a lot of them don't have that you're in the initial phase of treatment. But it's also important to know that in the initial phase of treatment, here's a key, is meeting with the client. So if you are meeting with the client, is meeting with the client. So that could be your first session with the client. In the middle phase of treatment has been meeting with the client. That lets me know that we have moved past the initial phase of treatment because we've been meeting with the client for a while. And a termination met goals, guys, or review different goals. And it's so important to know what phase of treatment you are in because with each phase of treatment, there's different things that you can do in each phase of treatment. In the initial phase, we're building rapport with the client, and you cannot confront a client in the initial phase of treatment. You can do it in the middle phase of treatment, but not in the beginning, in the initial phase of treatment. And consent forms and fees and everything will be done in the initial phase of treatment. Okay. Who is my primary client in the STEM? Is it a minor, a child, or a teenager? We need to know the age of the client. That is so important because, and it goes to different consent forms being signed, but we will talk about that a little bit later. Adult, couple, family, or groups. So it is very important to know who is the primary client. Who are you treating? In the question stem, there's different rules that apply when you are dealing with each one of these. I'm sorry, it went back. And especially working with a group, family, a couple, family, groups, and a minor, and depending on the age, guys, okay? How is my client doing in the STEM? Is there a presenting problem? The mood of the client, feelings, have they point out any feelings in there? Are there any immediate needs need to be addressed? Are there any concerns? Is there a crisis going on? Is there a psychological state, symptoms of duration? Or is there a diagnosis mentioned? We have to make sure that when you're going through the question, make sure that you're picking out on these. Like, is there something going on that I need to know about? Because you can easily pass through these if you don't know what these key identifiers are. What am I being asked to do? Is this a first question? What should I do first? What should I do next? Most, best, least likely, or accept? And first questions, we prioritize them in order. What would you do first? So the very next thing that you will need to do. And it all depends on the setting, age of client. So all of these different things basically go together, okay? Where is my client? Ask yourself that. And it's in the question stem. Where are you? Is the client in the office with you? Are you at home? At school? Or on the phone with you? So those are some things that you need to basically keep in mind, okay? What type of social work functions is the question asking for? Is the question asking you to build rapport building, assessment, diagnosis, therapy treatment, crisis, a safety intervention, resource linkage, or advocacy? And thanks for watching, guys. Subscribe to my channel. Also, like my Facebook page, LMSW Exam Secrets. If you have any questions, please email me. Thanks.